Hi, I'm Dr. Venu Gopal Pareek. I'm laparoscopic, bariatric and robotic surgeon at Hyderabad. Now, what are the do's and don'ts after hernia surgery? This typically depends on what type of hernia surgery you are undergoing, but there are typical do's and don'ts which are common for both. So, what are the do's? 1. Immediately after discharge, resume a little activity. Don't go over strenuous activity and don't start exercising because the body requires rest. Follow the surgeon's advice properly. Take the prescribed medications. Do not lift heavy weights and also keep a watch on the surgical site. Then what are the don'ts for hernia surgery? Typically, do not drive immediately after hernia surgery because it is possible that your surgeon must have prescribed you some opioid medications that may cause some drowsiness. So do not drive. Do not lift heavy weight after hernia surgery. Typically, a surgeon recommends not to lift heavy weight and heavy exertion for 1 month at least after a laparoscopic hernia surgery, or sometimes 2 or 3 months depending on the open hernia surgery. Do not soak yourself in a bathtub or swimming pool till the surgeon gives you a clearance about no infection at the surgical site. Apart from this, avoid constipation. Eat fiber rich food because the surgeon doesn't want you to strain for your bowel. So eat good nutritious food which is high in fiber so that the constipation will be avoided. Apart from this, do not smoke because smoking is known to delay healing. So do not smoke immediately post hernia surgeries. Take adequate rest, mobilize as soon as possible, but do not overexert yourself.